Hello children, welcome back. We'll start with a biology lesson, health and hygiene, and today we'll be learning about some diseases and their types. Let's recap. Health may be defined as a state of complete physical, mental, and social well being. A healthy human being is generally free from any disease. Disease that is when a body is not at ease or not comfortable to perform its vital functions normally. A balanced and healthy diet helps to stay away from diseases. Diseases can occur due to germs or microbes, lack of one or components of food in the diet, malfunctioning of vital organs, and unhealthy lifestyle. The diseases can be broadly classified into two categories: communicable diseases and non communicable diseases. Communicable diseases or infectious diseases. The diseases that can be transferred from an unhealthy person to a healthy person are called communicable diseases. Common cold, measles, and chickenpox are some of the communicable diseases. They are caused by microorganisms such as bacteria, virus, protozoa, and fungi. These disease causing microorganisms are called pathogens. The communicable diseases can be transmitted either through direct contact or through air, water, and food. Some diseases also spread through insects like mosquito, housefly, and cockroach. Such insects that spread diseases are called as vectors. These mediums through which diseases spread are called modes of transmission. Communicable diseases can spread through three broad ways: through air, through contaminated food and water, through insects and other animals. Through air. Air acts as a medium to transfer disease causing germs from an infected person to a healthy person. For example, in cough, cold, and other respiratory diseases, the germs are present in the windpipe, throat, or nasal passage. When the person suffering from these diseases sneezes or coughs without covering mouth, the germs are released with tiny droplets of water in the air. When a healthy person inhales the air contaminated with these droplets, the germs enter his respiratory tract and transfer the disease. Some diseases that are transmitted through air are influenza, tuberculosis, chickenpox, and measles. Therefore, we must cover our mouth while coughing and sneezing. Through contaminated food and water. Food and water are one of the most common modes through which different diseases are transferred to a healthy person. When an infected person bathes or defecates near water bodies, the germs enter the water bodies. When this contaminated water enters the food chain, it transfers the germs and causes diseases in the healthy person. The diseases that are transferred through a consumption of contaminated water are called waterborne diseases. Cholera, typhoid, diarrhea are some of waterborne diseases. These diseases can be prevented by adopting methods such as drinking filtered water, keeping drinking water covered, and drinking boiled water. Through insects and other animals. Some animals, such as flies, mostly sit on contaminated waste that acts as their breeding ground. When these flies sit on the food that we eat, they transfer the germs in the food. On consuming this contaminated food, the disease gets transferred to a healthy person. These insects may also transfer the germs directly by coming in contact with the wound on the skin. Some animals transfer the disease causing germs by biting. Some diseases that are transferred through bite of insects or animals are malaria and rabies. The disease which we are going to study now is chickenpox. Chickenpox is a common disease caused by a virus named as varicella zoster virus. It occurs usually among the children of age group 5 to 9 years, but you can get it any time in your life. The disease is caused by a virus and the mode of transmission is droplet infection or direct contact. The symptoms are rashes and pockmarks on the abdomen and back. So for this, the preventive measures which we can take are isolate the patient from all public places, change patient's clothes daily and wash them separately using an antiseptic. The next disease which we are going to study is dengue. Here the mode of transmission is by the bite of the female Aedes mosquito. So it is a vector-borne disease. The symptoms are headache, fever, joint pain, muscle pain, nausea, vomiting, abdomen pain, cough and loose motions. So for this, the preventive measures are use mosquito repellents, prevent mosquito breeding, and advices are immediate blood test on doctor's advice, rest and drink plenty of fluids. Rabies, a virus that attacks the nervous system and is fatal once symptoms develops and is passed to humans through bites and scratches from infected animals. So the mode of transmission is through animal bites and the symptoms are fear of water, that is hydrophobia. And the preventive measures taken are the dogs should be immunized and vaccination should be given timely. Polio. Polio is a water and food-borne disease. What is poliomyelitis? Polio is a highly infectious viral disease which mainly affects young children. The virus is transmitted through contaminated food and water and multiplies in the intestine, from where it can invade the nervous system. The symptoms are paralysis of limbs and the preventive measure is vaccination. Amoebic dysentery is a protozoan infection. Mode of transmission is through contaminated food and water. The symptoms are abdominal pain and discharge of blood-stained mucus through the stools. The preventive measures are proper sanitation, cover and protect food and water from dust and flies. Tuberculosis, it's a bacterial infection. The mode of transmission is droplet infection or airborne infection. The symptoms are chest pain, prolonged cough, releasing blood, weight loss, weakness, fatigue, decreased appetite, night sweats, and increased body temperature. The preventive measure is BCG vaccination given. Prevention and control of tuberculosis. Prompt and effective treatment of patients with active tuberculosis and carefully follow up of their contacts with tuberculin test and x-rays. Drug treatment of asymptomatic tuberculin positive persons, then the immunization and the eradication of tuberculosis in cattle and the pasteurization of milk has greatly reduced. Typhoid. Typhoid is a bacterial infection. The mode of transmission is through contaminated food and water. The symptoms are fever, headache, rashes on the body. How can typhoid be prevented? Human waste and excreta should be deposited in a covered place. Avoid eating or drinking food from street vendors. Avoid raw fruits and vegetables. Eat foods which are thoroughly cooked. Use clean water. Get vaccinated. Non-communicable diseases. The diseases that cannot be transferred from one person to the other directly or through any other vector are called non-communicable diseases. Diabetes, heart diseases, lung diseases, and deficiency diseases are some non-communicable diseases. Deficiency diseases. They are diseases which are caused due to deficiency of certain nutrients in our body. Example, kwashiorkor is a protein deficiency disease, whereas rickets is caused due to deficiency of vitamin D. Let's recap the topic by revising the differences between communicable and non-communicable disease. Children, please go through all the pointers. So, children, please do revise the concepts discussed today. Have a great day ahead. Thank you.